வணக்கம். குட் மார்னிங் எவ்ரிவன். இன்னைக்கு நம்ம ஒரு பேஷண்ட்ஸ் நமக்கு questions அனுப்பிச்சிருக்காங்க. ப்ளீஸ் ஆன்சர் தீஸ் questions and we would like to know a bit more from this அப்படின்ட்டு அந்த questions one by one we are going to go through them. The first question is, do vaccines cause autism? It's a very good question. ரொம்ப இம்பார்ட்டண்ட்டான கொஷின். நிறைய பேரண்ட்ஸ்க்கு இந்த காலத்தில் இந்த மாதிரி யோசனைகள் இருக்கும். But to answer this question, I need to take you back to 1998 when the paper by Dr. Andrew Wakefield, a gastroenterologist, caused commotion in the community. அந்த பேப்பரில் அவர் சொல்கிறாரு, MMR vaccine and autismக்கு லிங்க் இருக்குது அப்படின்னு சொல்கிறாரு. அதுக்கப்புறம் it created huge controversy. Following that, even the journal which published that article retraced that article. Apparently, a lot of parents have written to the doctor saying that their children suffered a lot of problems following vaccination. Apparently, இது ஒரு பெரிய கான்ட்ரவர்சியா போயிட்டு இருக்கு, and we've been seeing a lot of people for and a lot of people against this vaccination. இது background. So what we will try to understand now is, vaccine-ங்கிறது என்ன? When was it first introduced? It was first introduced in 1798 by a person known as Dr. Edward Jenner. He was the first person to make the vaccine for smallpox. But what has changed from 1798 to almost 200 years plus now? Things have evolved. Science has evolved, biotechnology has evolved, biosciences have evolved. So has the preparation of the vaccines, which has evolved over time. Edward Jenner போட்ட first vaccineல there were no preservatives added. இப்போ நம்மளுக்கு we know there are preservatives in food, we know there are colorings in food, we know there is MSG in Chinese food. Everything we talk about preservatives and everything and additives. அதே மாதிரி vaccines to increase the length of lifespan of the vaccines, to make it more viable, people started adding preservatives. Now, what are the preservatives in those vaccines? Things like phenol, things like mercury, things like aluminium. All these heavy metals have become what is called adjuvants in vaccines. And the vaccines அதெல்லாம் போடும்போது the effects of those metals on your body, for example, heavy metals cause a lot of disruption to your gut microbiota. It causes a lot of disruption to the lining of the cells. Heavy metals toxicity is a leading cause for cardiac and other morbidities. So, we have to, how careful you are in selecting and searching for your food. You make sure you want your organic food, you make sure you don't want any pesticides in your food. Similarly, you should also think about all these things when you're vaccinating your children. The cumulative dose toxicity அப்படினு ஒன்று இருக்கு. What is cumulative dose toxicity? இப்போ நீங்க for example, ஒரு சின்ன எக்ஸாம்பிள் சொல்றேன். ஸ்டெராய்ட் க்ரீம் கொடுக்குறாரு டாக்டர், நீங்க போன ஒரு ஸ்கின் கண்டிஷன்ஸ்க்கு. ஸ்டெராய்ட் டேப்லெட் ஒன்று கொடுக்குறாரு. ஸ்டெராய்ட் க்ரீம் ப்ளஸ் ஸ்டெராய்ட் டேப்லெட் ரெண்டுமே எடுத்தா the dose on the cream and the tablet will be greater than what you are consuming. So 1 plus 1 will be 3. The effect will be 1 plus 1 will be 3. அந்த மாதிரி நீங்க யோசனை பண்ணிட்டு, our generation, when we took vaccines, we had 4 or 5 vaccines, maybe 6 vaccines, the entire childhood what we took. இப்போ 15, 20, maybe even more vaccines are available, and that is the cumulative dose toxicity, because all these preservatives and additives of thiomersol, which is an organic mercury, and aluminium, which is an adjuvant in these vaccines, that cumulative dose toxicity is affecting our bodies. There is no doubt about it. However, how you can also ask, எல்லாருக்கும் ப்ராப்ளம்ஸ் வரதில்லையே? எஸ். why only some people develop the problems with regard to the vaccine is because of their genetic element and the genetic makeup. எல்லாமே ஜெனட்டிக்னு சொல்ல முடியாது, but definitely there is an element of people where their genes are not playing ball with their health. So when they get these vaccines, they show a deterioration in their health. So இது although we are talking about childhood vaccines and autism, this applies to all the vaccines. And of late, in the last few years, what we have seen is COVID and the COVID vaccine. அது மறுபடியும் we will speak in our next video regarding this. But as parents, நீங்க you have to make a conscious decision which vaccine you want your child children to have, and how important it is for them to make, for you and for them to have a healthy life with the vaccination program. சரி, உங்களுக்கு ஒரு சொல்யூஷன் கொடுக்குறேன். நீங்க வந்து okay, I want my child to be vaccinated, but I don't want them to have any of the adverse reactions அப்படின்னு நீங்க நினைச்சீங்கன்னா, there is a way out of it. We use what is known as a pre-vaccination protocol, and there is a post-vaccination protocol. Pre-vaccination protocol, it is a selection of your vitamin D, vitamin C, multi vitamins and multi-minerals in a certain dose and certain program taken for a few days before, and something similar taken for a few days after will mitigate and reduce the side effects, if any, of the vaccines. And also taking your multivitamins and minerals on a longer term basis and maintaining your vitamin D and other levels optimally will also ensure that your side effects from these injections will be less. Thank you.